I will now be speaking to Joss Harding. Welcome, Joss.
Thank you very much for inviting me. It's an absolute honour. Thank you very much.
Oh, well, thank you for joining me. So I'm going to get started with the first question. Joss, what challenges do you generally encounter with patients who are undergoing cancer treatment?
So there's many different angles to this question, actually, and I've sort of written a list so I don't forget anything, because it's really important. A lot of patients, when they're given the diagnosis, you have cancer, everything goes out of their mind, and certainly mouth care potentially is last thing on their list. And so there's lots of things that can influence their journey, and if we can get mouth care as good as it needs to be before they start that journey, that makes it a whole lot better. However, are the patients regular attenders? Do they have a fear of dentistry? Can they afford dentistry? You know, how much time do they actually have before they start their treatment? Because sometimes they're given a diagnosis and they're straight into it. So do they have the time to actually go back to a dental practice to have a checkup to see if they're okay oral health wise? You know, it's a big thing. Maybe they've got some decay there. Maybe they've got a grumbling abscess, but they don't know about it. So this could be going on during their treatment, and it does actually have the potential to stop their treatment if they become really poorly. So oral health is really important. Diet control. So are they a risky patient? Do they have decay because their diet's not controlled? Certainly going through their treatment, their diet will not be controlled generally on the whole. They're not able to eat good substantial meals. They may be grazing. They may be even being peg fed by a different option for getting nutrition into them. So it's lots of things that we have to consider. So if dental health isn't on their radar, then it's not going to be on their radar while they're going through the treatment, unless they come into pain, which hopefully they don't, but sometimes they do. Gum disease, are they a regular attender? Do they have their gums looked at, checked? Do we look where if we got that opportunity to be able to get them to brush better, show them what's out there? Do they change their toothbrush regularly? Do they use anything interdentally? It's all big questions, but things that can actually tip the balance between being healthy and not quite so healthy. Do they have the dexterity? You know, do they have a carer? You know, there's all these questions about oral health and things we need to take into consideration. Do they have dry mouth to start with before they even start their treatment? So do they have a comorbidity? Are they mouth breathers? Are they dehydrated? How many of us actually drink the amount of water that we should be drinking in this time? You know, a lot of us aren't good at that. So we're no different to anybody else. Is polypharmacy going on? You know, how many medications are they actually taking? You know, a lot of people are taking an awful lot of medications, and so they have a dry mouth to start with before they even start their chemotherapy or radiotherapy. Oral mucositis is a common problem that a lot of people would suffer with going through treatment, and it can happen sort of 5 to 10 days after starting the chemo or 14 days after radiotherapy. So this can really affect the mouth. The WHO gives you gradings from 0 to 4. So 0 is no oral mucositis and 4 is fatal. So often it's one of the big reasons why people are actually readmitted into hospital, because their mouths are so sore. So this affects their nutrition. Are they able to eat? Are they able to drink? Some can't even swallow. Some can't drink water. It's incredibly sore. So they need to be cared for. It needs to be watched for oral mucositis. A lovely clinical nurse specialist explained it to me once, and I often talk about this in my presentations. They explained oral mucositis being, if you imagine your mouth is burnt with pizza, imagine that hundreds and hundreds of times. And that doesn't just affect your mouth, that can affect you all the way down your alimentary canal. So it's not pleasant. Often it will stop as soon as they finish the chemo and they've got through that. Radiotherapy, like I say, it happens for quite a while afterwards, especially for our head and neck cancer patients. And that can be detrimental for lots and lots of reasons. Halitosis is a common problem. Is it because they're constipated, because the medications that they're taking? Is it because they're dehydrated? You know, lots of knock-on effects because of treatment, and this might be a problem before they even start. They often get a change of taste, so they might get a metallic taste or things that they enjoyed before, because food is about enjoying things. Food is about being sociable, and this often stops during treatment. Often, not for everybody. Some people don't have the effects. It's very patient specific sometimes. It doesn't matter if it's the same medications, same types of cancer. There's 200 types of cancer and subtypes. There's 100 types of chemotherapy. You've got all the immunotherapies that are coming on now. You know, are they getting the same reactions to the treatment? So there's so many variables, you know. So change taste is often common. They'll often say they've gone off their chocolate. They'll find that they've got a metallic taste. Everything tastes salty. Lots and lots of different challenges for them. So yeah, a bit of a list there, I'm afraid.
So, well, thank you, Joss. So many things to be taking into account. Thank you so much for sharing all you have. And from your experience, what should we be considering as clinicians before making suggestions for particular patients pre, during and post cancer treatment?
So the first thing that I learnt, and I was told, you know, to be aware of, is to listen, and to listen to what they are telling you, because we know all of this stuff. We know what we can do, what we can help with, but do they want that? So the first thing is to listen. Obviously, we want to get them on good fluoride toothpaste. We want them to be potentially mouthwashing with fluoride mouthwash at a different time, especially if you think about how they're going to be eating through treatment or drinking through treatment. They might be watered, they might have been really good before treatment, but actually just something like squash or something can help them through. So all those opportunities of raising the risk for tooth decay and obviously gum disease if their cleaning isn't so good. So we have to listen to what kind of patient are they, you know, so we can make the recommendations. I do like to give mine a goodie bag to take away with them so they feel cared for. It gives them options. They may not need them, and I always say to them, check with the oncologist if they're happy for you to use these products, because it's all about collaborating with the other team members that are working with these patients. And like I say, the math isn't always thought about, but we want them to be cared for once they come back to us and to have as little damage as possible. So yeah, so I try and give them some gentle advice if they're not regular attenders. If they're regular attenders of mine, they know what my spiel is and how we look after them. Can't generally see them during, although I've had emails and I've had phone calls from wards and things when patients have been, you know, just wanting a bit of a chivvy up. So I can sort of talk to them then. And then after they come back, you know, once they're released back to us, potentially, although some patients are on long-term chemo, so it's knowing when to see them in their cycle. So this is about what we need, is more collaborative practice. So we need some more interprofessional talk going on, really. So it prevents that tired and fatigued patient coming back to us and, you know, looking after them.
And what do you consider before recommending products to a patient? And how do Biomin products fit in?
So lots of patients know lots of things about lots of products. So you have ethical reasons for recommending things. So, you know, you've got to think about people's backgrounds, religions, different things that might be in products, whether it's got animal products in it. Some people might be vegan or vegetarian. You have to be aware of that. Be aware of the pH of certain products, you know. It's interesting because a lot of the manufacturers are taking these things on board, so they're quite welcoming sort of those sort of questions, those routine questions I ask, you know, and it's nice to be able to offer something that's not tested on animals, not got any animal ingredients in it, you know, it's got a good pH, got lots of evidence base behind it, and it's a lovely option. The patients will buy things from all over the world. They don't necessarily even care if it's evidence-based, which for us, we go, oh, but actually patients will try anything and everything. If it makes them feel better or their best friend said it's a good thing to try, they will try it, you know. So it's good as professionals that we know what products are out there. And
how does Biomin fit into this?
So I love Biomin. It's a lovely option, you know, it's very low mint, low on the RDA. It's got SLS in it. It's not tested on animals, got no animal products in it. It's got the low fluoride. So if you've got our patients, which, you know, I work in an area that's quite alternative, they don't necessarily like the fluoride. So it's nice to be able to offer the Biomin C, but you've got the Biomin F, which has got a lot lower amount of fluoride in. You've got the calcium phosphate in. So they understand that science. So it's nice to be able to point them to a lovely product, a lovely option.
Yeah. And how do you try to improve the quality of life for your patients? Because from my experience, oral med departments have maybe a low awareness of remineralizing toothpaste like Biomin. So how could we improve their awareness?
It's all about discussions, being able to maybe do some team training, maybe sending out emails, or maybe having a Zoom meeting with your team, seeing how open they are to other options, pointing them towards the science of different things. So yes, it's all about communication. I like Biomin. It's a lovely option. I'm very lucky to have samples that I can give to the patients to try. The clinical nurse specialists, who have a lot to do with the patients and the families, they do a lot of communicating. So if the patient isn't getting on with one particular product, they'll come and shout about it, and then I'll give them something else to try. So it's nice to have different ranges of things to try. So yeah, it's all about communicating with the team.
Yeah, and working more, as you said, the multidisciplinary team, and us learning as well to collectively. It's key, isn't it? Because of the complexities of so many things to be taking on board for these patients in particular. And in regards to quality of life, how do you improve the quality of life for your patients, Joss?
Listening to them and asking them about their families, because it is a ripple effect. It isn't just that patient. They're very important, but it ripples out to their families, to their parents, to their loved ones, so it's important to ask about all of those. So quality of life is very important. It's about pointing them in the direction for support. So a lot of them might be going through financial difficulties. A lot of them may be depressed. Some people have their dips and troughs with this journey, and it's important to listen to that. And then if they are saying they're not sleeping well, or if they're feeling very low with their moods, then to make sure that you know who to contact in the team or who to refer to. And if it's in your general practice, then to refer back to the GP or ask the patient if they're happy for a little bit of support. And we're very lucky in our profession. If we've got the time, we can say, how are you? And then listen to what they're saying, because it's really important to listen to that. We can certainly clean the teeth, we can look after them, we can point them in the direction of good oral health, but it isn't always people's priority. And especially when they're going through cancer treatment, often we will be stuck with, you need to be eating your 3 meals a day, and you've got to watch out for your snacks. Actually, specifically for my head and neck cancer patients, because they lose so much weight during their treatment, I say to them, eat and drink everything, and we will look after your teeth. When you come back to me, we'll help you out, and we'll get you back on the right road. And that point is really important for long-term care. So it's to guide them, and if they're not going to listen, then that's fine too. You have to be aware of that. Some patients don't want to listen, some patients don't want treatment either.
And what results have you observed from patients who use Biomin?
So patients in general practice and the hospital, it's a lovely option. They love it. Patients who are sensitive, so a lot of patients who are eating a lot of fruit through the day, or drinking a lot of squashes or fruit juice, because everybody's trying to be healthy. We've got to protect the teeth, so they understand the science of Biomin. So it's a lovely option. And they come back and they want to know if they've got another sneaky sample they can take away with them, or but yes, they really enjoy it, and they've noticed a big reduction in their sensitivity, which is perfect.
Yeah, again, impacting quality of life. Well, Joss, it's been a pleasure speaking to you, and thank you so much for joining me.
Thank you very much for inviting me. It's an absolute pleasure. Thank you.